Women have several options when it comes to breast reconstruction surgery, so let's talk about the different procedures available. There are many options for breast reconstructive surgery. When I talk to women about breast reconstruction, I generally talk in two different camps of breast reconstruction. On one side we have implants and tissue expander based reconstruction, and on the other camp we have autologous, or using your body's own tissues. And there's also a category that combine the two, but those are the two major categories that we address. There are benefits and disadvantages to both, and each woman has different criteria that make them a candidate for one or the other. So let me give you some examples of how we guide women in making the right choice for her. So for one of the camps, for the women who choose implant or tissue expander based reconstruction, I recently saw a woman who was 36 years old who detected her own cancer after finishing her first marathon. She was a mother of two. She was very thin and didn't have a lot of her own body tissues to use, wanted to get back to her lifestyle of running and taking care of her children as quickly as possible. So for her, we talked about more implant-based reconstruction using a tissue expander, understanding that over the course of her lifetime, she may need multiple small surgeries to maintain that reconstruction, but the early operation and recovery is much shorter. So that was the best option for her. And the same day, I saw a 37-year-old woman who had more of her abdominal tissue to donate and didn't want to think about breast reconstruction for the rest of her life after her initial operation. So for her, we talked about using her body's own tissues, which would grow and change with her as she aged, rather than using an implant or tissue expander-based reconstruction. So for her, that was the right choice.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.